present. Dr. Beatriz Mella Lira is a postdoc researcher at the Catholic University of Chile, which is a great institution. And I noticed that she's now working at two centers, Center for Sustainable Urban Development and also the Bus Rapid Transit BRT Excellence Center. So I look forward to hearing from you, Beatriz.
Thank you very much for the invitation. It's so nice to see you all here. I was hoping to share my screen.
Yes, you should be able to.
Not yet.
Okay, let me work on this. I'm sorry. Yes, this was my mistake. Now you should be able to share your screen.
Perfect. This one. Can you see that right? Okay. Yeah, thanks again for the introduction. Today I'm going to talk about transitions to mobility during the confinement. This is all around this idea of co-production of mobility and urban strategies during the sanitary crisis. And the context is Recoleta, which is a municipality in Santiago in Chile. Recoleta is located in the northern area of Santiago, where, as in many contexts, the pandemic showed very strong inequalities. The most disadvantaged municipalities, such as in this one, have had the highest rates of contagion and the highest rates of deaths as well. And some reasons for these inequalities are the precarious housing conditions, lack of daily economic solvency, lack of spaces for public use, and especially overcrowding, as you can see in these pictures. We have here a lot of activity in the streets, in the public and the private space, in the markets. So it's an area full of free markets. And this is a normal day during the lockdown, August last year. So you can see a lot of people, a lot of overcrowding, and this is one of the main issues of the commune. And we will see other issues that we found with this research. So since last July, and this is also part of the institutional context, there's a government program that suggests 5 steps of opening towards normality. So step 1 is complete lockdown, and step 5 is total freedom. So the communes, and not necessarily the cities, jump from one phase to the other, moving backwards and forwards depending on the number of daily cases and the hospital availability. So during the period of the research, Recoleta, this municipality, jumped from the step 2 to step 3 towards transitions. And also part of the context is that the research lasted approximately 3 months after the first wave, and when considering the transitions towards the confinement. So jumping to phase 3. And at this point, and this is very important, the central government offered funding for infrastructure interventions towards reopening. So there is one, they called us, the municipality called us as research team for helping with the mobility strategy. And so I won't be able to show all the research because it's a very little minutes that I have left, but I think it's important to highlight that we proved how important it is to read together with the communities the process of transitions and changes, especially during the pandemic. Co-produce the diagnosis of needs, the possible solutions, and the best interventions together with the community and the municipality was essential for the research and also for them as part of the results of the exercise at the end, or these action-based research. And at the end, the research was an excuse for facilitating these processes that did not exist before. So there were no documentation of these processes before, no associations, none of these practices. And we started like very much business as usual, doing this initial mobility analysis, looking at the intersections with the highest expected number of people waiting in bus stops, the number of trips between the zones within the municipality and how the trips were going outside as well, the location of services, the cycleways, the facilities, etc. And at this point, we figured that this was not enough, considering all the context that was happening. And we figured that there were different profiles as well in this municipality, in this big context, different profiles of people and territories, and the diverse people using these territories with a variety of day and night activities as well. So we decided to work with 4 territories, and this is a zoom in of the 3 of them: La Vega Market, Tirso de Molina Market, and Bellavista Neighborhood, all with different activities and eventually quite different problems as well, as you can see, as you can approach just by looking at these pictures. So what we did was to the second part of the methodology that we used was more interesting, because we had workshops with the municipality team in order to make a plan of how to co-create the diagnosis with the key informants of these territories. And for example, what should we ask, what we should know in advance, who to call as key informant, how to approach some of the solutions during the workshop as well. So many of these questions, we went around these questions with the municipality team. And then we had the 4 workshops with each one of these territories and the key informants of each territory. And then we did a thematic analysis for understanding what happened on those workshops and what were the issues, the problems, and turned out to be very similar in the different territories, even though we thought that they would be quite different. And we asked ourselves, what were the implications for future crises? What would happen in the second and the third wave? We already had the second wave. We're expecting, or we're kind of in the middle of the third wave now. What is happening after 5 or 10 years ahead and beyond? So first, we found that there's very little space in the streets available, and this affects functions and the use of public space. We also found, all of this is from the workshops, that there is a governance mismatch. So there's an incapacity to manage public resources and private activities. And we found that there's a huge problem around the issues of garbage and waste management, a huge problem. And we didn't thought that this would be so important for the different territories, even considering that they had such different activities during the day and night. And then also very important issues of security, personal security and safety. We also found that there is a social, economic and cultural capital in the comuna that should be improved or enhanced. Information, education, and the lack of fresh resources was an issue, especially in the context of the pandemic. And the coordination with public health, something that seems to be so essential, wasn't a thing. So this was a big issue. And finally, why this idea of co-production in times of crisis? First, because these experiences underline how important it is to understand the local needs, like from the people living in these territories. Then the co-production is not only informative for decision makers, but facilitates a commitment between citizens and their representatives. There's also a need for coordinated timeline for us, for researchers, for example, with the urgent needs happening like in a daily basis. So there's a need for doing a match between those. The other thing is that having no plans means a reaction-based rather than a plan-based strategy. And this is what happened with the municipality. They didn't have the means, the resources, or the documents or the procedures to do all this participatory process with the territories, and because they had the will to do it, but they didn't know how to do it. And for us, and probably this is the last point that I will mention, for us, it was important, this process of collaboration, of participation and co-production of methodologies, and these have proved to be very useful as well in different contexts. So finally, just to thank to my dearest team from CEDEUS, Jaime Sosa Barra, Dr. Ignacio Tiznada, and Dr. Leigh Sagaris, who also participated very actively, and they were essential for the research as well.
Great. Thank you so much, Beatriz. And this is a really important topic, looking at the co-production in cities of urban space, urban transport, mobility, and which, when in the interaction would determine the actual outcomes of behaviors. And unfortunately, we don't really have the time for questions. So I encourage colleagues to perhaps come back to you for more questions. Thank you, Beatriz. Now, what I would like to do now is to move on to our speakers in the program. So, Rolf, just to confirm that John hasn't turned up, right?
I cannot see him in the list of participants.
Right, that's fine. So we will see whether he will turn up later on. I would like to introduce Professor Lucy Budd from the Montfort University in the UK. And Professor Budd is a professor of air transport management, and we very much look forward to hearing from you. And notice that Professor Stephen Ison, who is a co-author of this paper and who is a professor of air transport planning, is also on the call. So yeah, so the two authors will present this paper. Lucy.
Thank you very much for your kind introduction. Good afternoon, everyone. The paper I would like to share with you this afternoon that I've written with Stephen Ison is based on a new notion we're proposing of responsible transport. And of course, we are all very aware, of course, that the pandemic has changed our lives in ways we could have barely imagined 18 months ago. And one of those effects has, of course, been a remarkable transformation in the way not only cities are used, but also in the ways that cities are experienced. They've created new ways of moving through them, using new technologies under new conditions. And what we wanted to do in this think piece is to propose a new and we hope quite provocative discussion around what we've termed this notion of responsible transport. And this concept incorporates not only the environmental aspects, which we are very familiar with under sustainable transportation initiatives, but we also wanted to embed individual health and well-being considerations. It stresses the role very much of the individual as being a responsible autonomous actor in delivering what we hope is socially desired transport outcomes. In our home city of Leicester, along with many cities across the world, the lockdown resulted in a very sudden and very remarkable reduction in motorised mobility. Not only did that, of course, lead to roads that were strangely devoid of vehicles and increases in permitted daily outdoor exercise, but it also encouraged people to experience the environment in new ways. And a lot of people remarked on the fact that they could hear birds singing. They could speak to one another without raising their voices. And the local authority in the city actually responded by investing, as a number of authorities did across not only the UK, but elsewhere around the world, in what they termed pop-up active travel schemes. And here we've got not only an image, but also a schematic of some of the pop-up cycle lanes that were introduced in Leicester. And of course, this much more localised and far less carbon intensive transport mode indicated not only the scale, but also the extent of the changes that we could look to transition to and sustain after the pandemic if there was public and political will to do so. So we have proposed a new concept of responsible transport. And we see this very much as delivering transport that is not only safe from a collision perspective, but also a personal perspective, that is secure in terms of personal safety, but secure from external threats and influence, but is also equitable. And it's mobility that is going to embed not only the environmental perspectives, which are so important, but also the social and economic ones too, which are going to be so key to how we recover and move forward from this situation. So we're seeing very much responsible transport as embedding these three elements, and we like to see them at the heart of post-COVID transport policy, planning and operations, because we would like to reach a situation in which individuals can make considered transport choices. Now, of course, any transition towards responsible transport is going to occur in a rapidly changing policy environment. We know that we have new technological innovations, not only e-bikes, but also urban mobility. We've also got a whole range of service innovations with respect to ticketing, with respect to integration, with respect to apps and smartphones. And these, of course, are going to impact on individuals' mobility choices. Now, of course, for individuals, responsible transport is going to be shaped by the provision of suitable modes. But if we assume that these are in place, it is going to involve us as individuals taking responsibility for our own mobility, just as we have been encouraged to take responsibility for our own health in the pandemic. The public health messaging in the UK about keeping your social distance, washing your hands, wearing a face mask. It was very much encouraging us as individuals to take responsibility for our actions. And we feel there is scope to actually embed this in future transport policy and planning too. So if we transition to a more responsible transport scenario then, as individuals, if we have suitable modes at our disposal, we will need to decide whether we need to travel for work-related activity. We will need to decide if our meeting, our conversation, our corporate event could be held by virtual means with which we have had to become oh so familiar. Now, of course, there will be situations in which physical travel is required, that face-to-face proximity is necessary. But of course, then it is going to be incumbent on us to select the mode with the lowest not only environmental impact, but the lowest social impact too. So we see very much this concept as the start of a discussion and not the end. Clearly, this is a very dynamic rather than a static process. It is bound to evolve. It will evolve in ways we cannot yet begin to conceive. Clearly, there will be a need for the right policy, right place, which is going to be aware of and cognizant of the individual situations in different places, for different people at different times around the world. But we would very much welcome your thoughts, your opinions, either later on in the discussion today, or of course you can contact us directly. And do please, if you're interested, have a look at our initial think piece, which was published as an open access publication in Transportation Interdisciplinary Research Perspectives in the middle of last year. Thank you very much.
Thank you so much, Lucy. Really a thought-provoking idea. And is Stephen also online? And does Stephen like to say anything? I'm just checking. If not, could I ask you one quick question while monitoring the chat box to see whether other questions come up? So do you think there are some parallels in the public health arena of for example, would you be able to learn from the past and current public health campaigns, including the campaigns to mitigate the pandemic? So that do you think there will be parallels between public health and transport demand?
I think that's a very interesting point, and certainly in our early conversations when we were developing this idea, we were very much aware of the public health messages and also how they changed and how people responded to them. So clearly I think there is huge scope for policy transfer between the medical disciplines and also public transport and active transport, and there are such clear parallels between the two. I think it would be a very fruitful avenue for additional conversation and research. So yes, I agree. Thank you.
Yeah. And another thing which I might mention is that the machete is constant. This is the constant of people's fixed budget of travel time. And this may change, of course, after the pandemic and as more e-contact actually embed into our lives. But there are some constancies in in travel. And I just wondered whether these have been already taken into account. If not, these should actually be looked at.
Yes, certainly it's relatively early days in terms of the work that we've been doing, but certainly that is something where there is huge scope to incorporate not only disciplines from engineering and the social sciences, but also the environmental sciences and psychology as well. So I'm quite excited about the prospects for this, and it'll be interesting to see what people's reaction is to it. As I say, it's very much the start of a conversation, not the end. So it'll be interesting to see how it develops.
Yeah, and in relation to this, I assume that Tim Jones, the earlier speaker, also posted a comment to say that problem is that in the UK, the public health message was not backed up with the structural support. For example, sick pay is a paltry £95 per week in the UK, so working poor were left with no choice but to travel to work. So I presume that actually connects it in several dimensions.
Yes, absolutely. And you'll notice on the slide there that we put in that important caveat of if suitable alternative modes are available. So there is an awful lot of foundational work that would need to happen before we get to a situation in which people can take those, responsible transport decisions. So this is very much an aspirational think piece, but certainly something we feel is worthy of further discussion and debate.
Thank you, Lucy. And I wish we had more time to talk, but it's a really thought-provoking piece, and I look forward to reading your paper as well. Now, I would like to now introduce Anson Gock, who is a policy official from the Delaware Department for Transportation in the United States, who is going to look at the relationship between COVID-19 and the crash patterns, and a hugely intriguing topic. Anson, we look forward to hearing from you.
Hi, thank you. Can you hear me?
Yes, indeed, very well.
Okay, I'm going to do some share screen here.
Yes, please do.
Yes, can you see my screen?
Yes, and if you do the slideshow, then
yes,
everything is perfect.
I'm going to handle that way. Thank you.
Yeah. Mm-hmm.
Can you see my screen?
Yes.
Okay.
Now in the presentation mode, yeah.
Okay,
it's all perfect, yeah. Go forward. Yeah.
First of all, thank you very much for this opportunity for me to share. This is also presented by my friend at Delaware DOT. So I would like to start as a very brief introduction. I'm a planner for Delaware Department of Transportation. Delaware is also considered as the first state, as we were the first state in the United States to ratify the US Constitution. We're located in the Atlantic coast. We're very small, population-wise and land area-wise. And we are being sandwiched by, I guess we have border share with, Maryland, Pennsylvania, and New Jersey. And we are approximately 100 mile or 160 kilometer northeast of Washington, D.C. So what happened to COVID-19? What happened to traffic? Did it go up? Did it go down? Did it remain the same? Based on the US DOT information, as you can look from this chart comparing to 2019 and 2020, 2020 is in red. You can say there is a drop of the vehicle trips, especially in the US. Our lockdown, various state has various stage, I should say. So, but most of them started in March or April. So you can see a very big drop in terms of vehicle trips in comparison, all the way till September here. And as we also look at some of our local traffic, This is our US 202 daily traffic volume count at our Pennsylvania and Delaware state border. You can see at this little red vehicle, that's where the traffic count location's at. And we have this comparison between 2020 and 2019. And you can see this, the drop. I mean, it's not exactly the same, but you can see that, you know, the pattern is similar to the national pattern. This is our critical route that connect us to Pennsylvania. We have people commute there. We have manufacturing, we have freight. That's also one of our important freight route too. As well as there are also people and business along that particular route. And we look at the VMT using, I guess, you know, online and streetlight data as well as index data. You can see VMT drop in our 10 major metropolitan areas, also within our state, by approximately 17% to maybe even up to 40, 50%. And now here we kind of look at travel time along our 202 corridor again. Here we're looking at our AM peak, PM peak, and our weekend travel time. I would like to move on to another slide that kind of translates some of these data into a chart or graph form. As you can see, the travel time actually increased for that particular corridor between March and May. That's when the lockdown began. Means one can argue that you have a little bit less traffic on the road, a little bit less traffic congestion. So travel time increased both of our AM peak hour or peak period as well as PM peak period. And then the weekend kind of respond the same. But I would also like to know during the weekend, especially between June and September. That is our, I guess in the US, is our summer vacation month. We do have some tourist traffic, as well as summer traffic. So that kind of go back to normal is actually kind of worse. So people seem to get out quite often during the weekend evening hour, to be very specific here, okay? Around 4, I believe it's around 4 p.m. to 6 p.m. However, when we look at some fatality data, you know, it increased a little bit as far as alcohol related, as well as seatbelt not used fatality, it went up. This is not just shared just in Delaware, but also shared with some other state and some other city that I have seen or heard. Then we also look at other data. We go back to speed again. Of course, you know, the average change in rush hour speed has increased in major metropolitan area. Of course, the one that closest to us, you know, Washington, D.C. and Philadelphia. And I also like to look at this particular chart. It's about the alcohol sales, the retail sales of beer, wine, and alcohol. If you look at a pattern of which is the green, which is the blue line, it kind of flat, but it take off significantly when the lockdown happened, and it kind of still remained to be pretty high there. So that is pretty interesting. I cannot speak for other places, but in the US, that appears to be the pattern there. However, though, there's some issue definitely for further exploration. Try to understand where these crash patterns, especially the fatality one, are they occurring in urban area, suburban, or rural area? Are they in different types of roadway, interstate road, local road, or maybe major city route? And try to understand what is the possible cost, you know, the vehicle speed, or driving under the influence. I guess in the US, the way we classify driving under the influence is not just only alcohol or wine, up to a certain level, as well as recreational drugs, as well as medical just prescription. So those are all kind of classified as under driving under the influence. So if we have better understanding of these circumstances, because I guess I heard from our previous speaker back in February 25th, some of the people are experiencing financial stress. I guess that financial stress, family stress, dealing with COVID-19, children, educational stress. A lot of kids are, virtual or semi-virtual, hybrid virtual. I mean, there's a lot of pressure for all kinds of individuals right now. So there could be some people in the press have talked about mental health issue for all age groups. So there's something that hopefully, with better understanding, we can handle these matters a bit better, and also try to deal with the driving under influence issue a bit better. And also hospital utilization, for example. In the US, I should say, in generally, the rural part hospital facility is not as comprehensive or abundant compared to the city. So that's why sometimes we need to see if the hospital not just handling COVID-19, if we have a certain search of certain area with high fatality, that we need to take that into consideration. We also need to look at the emergency response team resources. So they're dealing with a lot of factors here too. And finally, COVID-19 is not just a public health issue. It also can be a mental health issue too. In this particular circumstances, we do notice that traffic volume, VMT, are down, or will be down, or maybe remain down, since we don't know. More people, I shouldn't say more people. Some people may choose to work from home, but however, the essential worker will still have to go to work, the frontline worker. But our estimated fatality rate actually went up, especially for the quarter of April to June. I guess the question here is that, I don't know what's happening in other places or other countries. I don't know if this is the same pattern, but at least what I'm seeing. The question is that this evolved not just social, psychological analysis of this particular pattern, but understanding, and hopefully that we can do something to lower it. And I guess that's the end of my presentation.
Thank you so much, Anson.
Hopefully we can have better discussion, better insight on this particular matter here.
And thank you so much,
I'm going to stop sharing here.
Yeah, that's right. A really interesting perspective towards that, because we see from general statistics that the overall amount of fatalities on roads in most countries, I think including the United States, have reduced. But sadly, you have pointed out that the rate of fatalities actually have increased. Is that correct?
Yes, sir.
Yeah, and 2020 for Delaware is a special year with President Biden actually setting up his campaign headquarters, and then the president's candidacy, the president-elect office in Delaware. I presume that the traffic has not dramatically ramped up around his headquarters.
Of course, there are definitely some traffic in the Wilmington area. That's where his headquarters located, but in generally probably not. And also, you may notice that today's campaign are pretty much run virtually.
Yes, that's right.
Even
Yeah,
the
absolutely.
presidential, you know, I mean, there's not, you know, I guess this particular cycle year, many campaigns are done more online, I should say.
Well, it's hugely interesting. I would love to actually talk more, but we have run out of time there, and I really hope that you could circulate some more material so that we could read it, and then perhaps we'll get back to you, Anson.
Yes, certainly.
Thank you, Anson. And now it's my great pleasure to introduce Professor John Douglas Hunt, or Doug Hunt, who I noticed has joined us in the workshop. And Doug was not able to speak in the last session on the 28th of February, but I'm pleased that he's able to join us now. Doug, are you there? So if so, that the floor is yours for presentation.
We just lost him. He was here just a moment ago.
Right.
But he's not here. Oh, he's coming in right now.
Yeah, he's coming in. Yeah.
Connection maybe was interrupted.
Doug, can you hear us?
Yes, I can.
Yeah. So you are our sort of the final speaker in the series. So really good to see you, Doug.
Yes, nice to see you.
And I have already introduced you, so please share your screen and present.
Thank you very much. Appreciate everybody giving this extra time to fit me in. It's very kind. There, you should be able to see my screen now. Is that correct?
Yes, in presentation mode. Yeah, just go ahead.
Very good. Wanted to present, really pleased to be able to present, talking about the work we've been doing with a PECAS model of Alberta and looking at some of the anticipated impacts of COVID-19 on the spatial, economic, and transport systems in Edmonton, and then what some of the policy responses should be. And we've said that we start out with identifying what some of the behavioral attitudes are that are going to change. We assert what these are going to be and what the strength of them are going to be. And there's a wide range of possibilities, but what we've done is picked one particular set of assumptions. These are on, I think, the aggressive side or an extreme case. The intention is to sort of help bracket what the larger, sort of the envelope of impacts might be. What we did is listed here. We assumed transit use, attractiveness, a utility function had these additional penalties associated with it because of the discomfort of riding in close proximity with strangers. We said 90% of office workers in the service industries switch to work at home. This is clearly aggressive, but we see it as one of the areas where this could be a long-standing change that occurs because there's a savings on both the employer and the employee side. Out-of-home retail activity, we say reduced by 25%. Entertainment, appeal of entertainment and entertainment opportunities down by, outside the home, down by 50%. And the attractiveness of multifamily dwellings where there's shared interior spaces is down by 40%. There's a 40% reduction in the utility coefficient associated with this particular choice for dwelling type. When we do that and we do the simulation, what the model comes back and shows us, growth is slowed slightly in the Edmonton region. We do have an area-wide forecast that we are still maintaining, but this is a result for just a portion, a small geography out of the total geography of the model. So we're seeing a reduction in Edmonton growth relative to the base case. We see office space collapse province-wide. What we'd assumed was there was no repurposing of high-rise office space permitted. They would have to be retained as office space. This is really to help understand, the seriousness of a policy that, the lack of a policy to allow ready change of office space. Other office space can be demolished and rebuilt for other uses. Reduced rates of centralization. We saw employment shifts from the city to the region in the Edmonton metropolitan area. We see this as a result of work at home possibilities, reduced transit appeal, which focuses on the central area, and also shifting accessibilities. There's a range of things that are moving further out, and it's changing the relative accessibilities of the center versus the outer regions of the metropolitan area. Population growth shifts out of central Edmonton as well. This is in part because the mix of multifamily is much higher in the center and it's got a reduced appeal, and the shifting accessibilities that were also happening with employment. There's sort of a combined knock-on effect occurring. We see less travel overall. We see less use of automobile in aggregate, both single occupant and high occupant, but a greater proportion of the smaller total. Transit use is going down both in aggregate and in proportion. The transit impacted by those things we said were unattractive, and also by the change in city form. The reduced rate of centralization means that transit is not as effective for, its appeal is really servicing central area activity from radial trips, and we're not having as many of that. Reduced vehicle use and emissions overall. We do see an increase in diesel engine vehicles, more delivery, and so we actually see more particulate matter, but we see reduced CO2 emissions overall. We see lower rents in most places, except some of the farthest out, most suburban locations. But with these lower rents, we tend to see larger unit sizes and lower densities. I've got okay, so that's what we found. Just a bit on how we got there. My time is limited, so it'll just be pointing to a few things. We have a reference scenario that we use, and then we have a COVID scenario, and we're looking at the differences between them. We're using the PECAS software with the and theoretical framework with the Alberta model. It has objects that are activities, puts, technologies, and inventories, and we're simulating the movement of these, and then the economic activity, production and consumption activities, and their sensitivities to the prices and the transport costs to simulate the system, and it runs over time. I've just got a short diagram, a short film here showing the simulation. The development occurs parcel by parcel. households and businesses move in, the rents change, those are signals. Travel conditions change, and this is how the system evolves over time. This is just looking at one particular city in the entire province, and you can see the year. So it's just giving you a sense of the micro-simulation level activity representation in the system. What we're looking at is the Edmonton region, the whole province of Alberta. It's just a small part in the central part. The other major city is Calgary in Alberta. The Rocky Mountains are here, and we can see sort of what kind of geography we're drawing on. So we're simulating for the whole province, and so we don't really have boundary issues in our simulation the same way we might if we were only modeling this small area. You can see the change in population. Most of these results now, we're looking at the results over a 20-year period. Those things that I said we changed, we in the behavior, we kept them changed over the full 20 years. And this, of course, is not necessarily what is going to happen, but this kind of gives an outer bound with what the model says would happen over that time. So this is the change in population. You can see it's fairly minor in the whole region, but in the city it's a little bit larger. It's still growth everywhere, but it's not growing as fast. This is more an indication. The choropleth always shows what is the result after the 20 years. And these are the absolute changes in all household types of population. We also show the changes over time by having a series of bars, one of these for each year. The dark is for the reference scenario, the turquoise is for the COVID scenario. So we can better interpret when we see a choropleth with a red, it may be just reduced growth rather than an actual negative change in the number of people. It's a relative amount that we're indicating here. And I just don't have time to go through a lot of these, but we can see the decentralization that's occurring because of COVID inputs. This is the employment. We can see quite a substantial drop fairly quickly, about 10% drop in the city, moving to areas out in the region more. So decentralization again. In the very center, it's the most dramatic, but you can see in the inner ring as well. And this is where the employment is going, relatively speaking. Again, it's still changes in growth, not actual absolute changes, positive and negative. This is the number of occupied residential units. This is again part of the reduction in centralization. The rate of centralization is slowing. The rents, they're dropping as a result. This is rents for all structure types. The unit sizes, they're going up because the rents are going down, so densities are getting lower. And then average sizes, you can see they're going up. This is the trend over time. The previous was just the end of the 20 years. This is multifamily, economy level multifamily housing, the number of occupied residential units. We still see growth, but not as much growth with the COVID. This is the rents. We see drops in rents pretty well everywhere for this housing type. For multifamily luxury, we see reductions in growth, and again, changes in rents pretty well negative everywhere for multifamily luxury. This is the impact of it being a less attractive form that we put in the model. And then the developer model responds to those, and we get less residential space, the multifamily luxury category being built. And this is just scale versus the numbers, but we're seeing a shift of about maybe 10 to 15 towers of this sort of magnitude in each of these zones here in the center. It would be a noticeable reduction in the rate at which the skyline is growing. Then occupied office space, right? This is we can see here's the before situation, and then the COVID. You can see the rapid drop right when the COVID restrictions and people start working at home. And this, in our forecast, it never really recovers. The office space stays fairly unoccupied. There isn't the transition to other uses. And these are the rents, clearly large drops in the rents of office space. And the intention, as much as anything, was to get policymakers' attention to this particular issue. They need to be thinking now that employers and employees have found out about that it's possible to work at home, to remain reasonably productive. There's some people, of course, who prefer to work with people at some times, but the employers would also like to remove their rental costs if they can, download that onto the houses, people living at home in larger spaces. So we see that as a trend that could continue, and it means we need to start thinking about what to do with the space that otherwise could remain vacant for a long time as sort of office space not being used. This is some of our travel changes over time. The reference is the solid, and the COVID is the dotted lines for things: single occupant vehicles, high occupant vehicles, transit, walking, and these are the number of trips. And cycling just keeps right down there along the bottom. And then daily person kilometers traveled, roughly the same. And then the mode splits over time: 2016, 2025, 2029, 2039. The inner ring shows the before, without COVID as the reference. The outer one shows the response with COVID. We see reduced transit use. We see greater splits to automobile. Walking doesn't change a whole bunch. Biking just rolled right along at this very small amount. It's probably beyond the resolution of this model to do something reasonable with biking, but I mention it just because, and this is the fuel use and emissions, where we actually have a slight increase in particulate matter because of more diesel use, whereas we have overall reductions in the amounts of other kinds of emissions with COVID, about 8% drop with COVID. Where the vehicles mixes are changing, and we have a lot more truck, light delivery vehicle movement in this area. The scales are just shown, but I just wanted to point out this is a large, sort of the more warehousing and distribution areas, and this roadway component, these are all showing a greater mix of that kind of vehicle. And the overall is reductions in the amount of traffic. This is for the year 2025. Red is decreases in traffic flows. The message here was you don't need to be thinking about adding to your roadway inventory as quickly as you were thinking before.
Could you, because we really run out of time and the colleagues are disappearing, so
okay.
to speed up and
okay.
wrap up.
So, well, I was just showing how some of the accessibilities change with COVID. You can see the reduction in central accessibilities, the decentralization. Other things we looked at healthcare, for example, and it changed only the accessibility to healthcare changed only very small amount. And just to end up sort of kind of saying, we did this, we did publish these results, and then we've been watching. The downtown vacancy rate has risen to substantial levels in Calgary, the other major city in Alberta. It's also gone down substantially in San Francisco, right? It's about 14% now. Some is unleased and some is leased but sitting vacant because it's been abandoned. The housing market in some of the smaller towns on the edge of the Edmonton area, in sort of some of the more picturesque rural and mountainous areas, those are all booming. The increase in rents, we predicted multifamily is not increasing, but single family is. Superstar cities are in trouble. This is what the Atlantic was saying. Two things, I'll leave the slides, but things we were picking up as things we put into the model or got the model to be doing. The real estate market has steady throughout for detached houses, which we said, but the condo demand is falling substantially, and that's what we said would happen as well. So we feel a bit vindicated that we're not completely wrong. We're getting the trends, and then people are driving less, and we did have less driving. The one that we couldn't really get, the cycling is way up. Our model didn't pick that up. But anyway, that's my presentation. Thank you so much for giving me some time.
Well, thank you, Doug. And it does show the power of a model that's going to integrate different urban sectors in one model, and then all these different aspects could be looked and compared and assessed together. So I'd love to ask more questions to you, Doug, but really we don't really have time, and we're basically on the borrowed patients from the colleagues in the audience, so who are very grateful and of course still here in some months. But thank you very much, Doug. And very briefly, I would say that it's really encouraging from this session to see that the evidence of this forced experiment of pandemic lockdowns is accumulating. And I really would look forward to seeing more of this kind of research emerging, and hopefully the presenters of WCTR F1 group should host even more meetings in the future to look at these issues. With that, and with thanks to Rolf and